Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine that we put together here at the Virginia Institute for Public Policy each and every week so that you can go off into your week feeling a little bit better about the world that you and I inhabit. Thank you for joining us across the Commonwealth of Virginia. And, of course, you can find us online at tertiumquids.org. Our first guest, we're going into a period of time where I'm telling you, your Christmas gift-giving list is just chock full of great gift ideas, and we're going to start off with this book, and it is called The Devil in D.C., Winning the Country Back from the Beast in Washington. Cheryl Chumley is the opinion editor for the Washington Times. Cheryl, welcome back to Freedom and Prosperity Radio. How are you doing today?
I'm doing great. Thanks so much for having me.
I don't feel nearly as bad as the woman in Lynchburg who mispronounced the 5th District Democratic nominee as Cockburn the other day. So that's a good. I only stumbled a wee bit for us. The president's numbers, and I know you've written columns about this as well, considering 2 consecutive years of just unending negative news stories about a president, you would think that he'd be lucky to be in double digits, never hovering around 50% approval rating. Is there a real danger that the media has completely lost touch with the average American citizen, and that's what we're seeing going into this midterm election?
Yeah, I actually think that understates the matter.
Wow.
It's not just that the media is overlooking facts by accident. There is an active anti-Trump media, and this is not just a figment of imagination. This is something that I've seen as a member of the press, and it doesn't just extend to Trump. It extends to any conservative, any Republican, and it's something that I've noted in my book, Devil in D.C., and I think actually one of the best activism, efforts that a patriotic American can make at this time is to educate him or herself on what's going on in the news. Not just take one source, but do some research on all the issues. And if you're a conservative, don't even take Fox News's word for it. Look at different sources and come to an opinion based on different sources, because the anti-Trumpism out there in the media is significant, and it's even dangerous to the fate of our nation.
What I find interesting, Cheryl, is as the president goes around the country holding these campaign rallies for the midterms, and very reminiscent of the campaign rallies he held in 2015, 2016, leading up to the general election, is that this is playing right into his hands, because you'll have 10,000 people at an event in Texas. They'll go home, read some misquoting of something that was said or happened, and it's just making the president's case for them that they're trying to tell people what happened when they were there in the first place.
That's exactly right. And look, back when Trump was running his campaign and all the polls had him just losing, going down in flames, not just in the primary, but then when he was the candidate to run against Hillary Clinton, I was one of the few voices who believed to the end that he was going to win. And it's not because I'm great at predicting politics. I'm not. But the reason being is because I'm from Massachusetts originally, and I know how Massachusetts people think, and I watched with surprise just the rallies, the massive numbers that came out for Donald Trump in Massachusetts. And when you look at that with the rallies he held at the time around the nation, and just general knowledge that the pollsters are anti-conservative for the most part, and the media takes those numbers and uses them for anti-conservative purposes, it just seemed common sense showed that the country was ready for someone like Trump, and he did indeed win. And I see the same thing happening this election, this midterm. The candidates who are for Trump, they're being vilified in the press based on skewed polling.
You mentioned that, and I grew up in New York City. I'm about 15 years younger than the president, but I grew up and a creature of that city and watched him build his first building on the media because he needed some help from the city, in a city that was bankrupt, and they were arguing with somebody who wanted to employ people. And you go back and you watch some of the news clips from the late 70s, early 80s, and you say, well, hold it. He's saying exactly the same things. Just take Ed Koch's name out and insert Hillary Clinton Clinton or Nancy Pelosi's name in there now. And you realize this fella has been kind of fighting this fight all along. And that's what I told people is the media has always tried to tell people what Donald Trump was, and it was never actually what was happening. And often when proven wrong, the media has had a real bad record of going back and saying, yeah, I guess you were right all along, because I just don't think it's in their DNA makeup to get there. But what about our industry? Cheryl Chumley is on with us. You're a newspaper reporter. I'm a broadcaster. And, you know, in order for this country to have, the checks and balances, the people need to trust the news media, and they're not just getting public relations. And I've made this case before. I've worked for PR firms. I know the difference between PR and journalism, but that's lost in the modern newsroom, it seems.
Yeah, the people don't trust the media, and I pulled this story just for to discuss on your radio show to show why the people should not trust the media, as if there are any out there who trust the media. Donald Trump went to Texas to campaign for Ted Cruz. Mm-hmm. CNN put up this piece the day he was going to Texas that said, Donald Trump gets sweet revenge on Ted Cruz today in Texas. and what the piece was about, that it opened this way: on Monday night in Houston, Donald Trump will dunk on Ted Cruz one last time.
Oh, my gosh.
And then the author put that the rally that Cruz was holding was born out of necessity, and then went on to say that polling put Cruz ahead of his Democratic contender. So what this author was trying to do was make it seem as if Trump's going to Texas was actually what he would do because he's an enemy of Ted Cruz. And then he was also trying to make it seem as if Ted Cruz needed to hold a rally, at the same time admitting that Cruz is ahead in the polls. So it's this not even so clever way of skewing truths that the media paints a picture of Trump as if he's harmful to conservative candidates, and as if Republicans aren't winning in the polls. So this is the types of deceptions that happens daily in the mainstream media.
That whoever wrote that piece needs a chiropractor for all the contortions that they went through to get that written and to go through that. And polls are one of the great cases, Cheryl, of, there's lies, damn lies, and statistics. And every time a poll comes out, the first thing I do is I go grab all the questions, because I want to see how these numbers were driven. And more, the push polling has gotten subtler and subtler. And now these mainstream, quote, polls are really as driven as a push poll as I've ever seen. The questions are, so everyone hates Trump, but which would you rather have, Trump or, and you're like, well, of course everyone's saying the opponent, if the premise is already that, this is horrible and these bad things are happening, and yet we're building public policy, it seems, off of it.
Well, we are, and that's a clever deception of the pollsters and the media, and I would blame more the media, because by and large, I think most pollsters, they will try and maintain some semblance of unbiased polling because their livelihoods depend upon it. The media, of course, on the other hand, they can take those numbers and skew them any way they want, and there are so many different factors to look at. You're very intelligent, you're very smart, and the first thing you do when you see a polling story is to go to the poll and look at the questions, because the proof is in the pudding of the questions, the order of the questions, how they word things, the different types of answers that you're forced into accepting, the different types of conclusions that they make, the following questions based on the question that you answered previously. And then to me, the thing to always remember about polls, always, they are only glimpses in time. A poll 1 week does not mean that it's a fact a week later. So all these polls that are taken about who people might vote for in the midterms, they're meaningless to me. They really are just snapshots in time, and a lot of people actually lie to pollsters, don't admit who they would vote for. I don't know if they do it because they don't want their neighbors to know how they answered, or if they just do it to mess with the pollsters. But that's how it goes sometimes.
Cheryl, this left-wing hysteria. One of our Senate candidate from the GOP is running a commercial called The Angry Mob, connecting Tim Kaine to the angry mob. And Corey Stewart's ads, I think, make a great case for one of the things that I find most concerning is that it isn't even about political differences. Oh, here's how we're going to fix health care. Here's how I think we should fix health care, and let's debate it. It is, you don't want to be seen with these people because we'll break the windows on your car, or we'll key the hood of your car, or we'll harass your children on their way to school. And that really is a chilling sight to see. The only thing I really hang my hat on is that it's 5% of the population getting 95% of the coverage. But it is scaring people. How do we fix that?
Well, rightly so. I mean, the fact that, let's be real, the Democrats are the ones who are guilty about seeing baseball bats as a First Amendment right. They're the ones that take to the streets, the Antifa, the Black Lives Matter, and so forth, and pretend as if blocking off traffic and bashing windows and starting fires and ripping, doggy bags from Senate majority leaders leaving restaurants and throwing the food in the street. They pretend as if this is all First Amendment freedoms. The conservatives, the Republicans, by and large, don't buy into that. Now, there are a few. We just saw in the news that somebody put some sort of explosive device or suspected explosive device into George Soros's mailbox, something that I find abhorrent. As much as I detest George Soros's policies, you don't do that. That's just not sane. But this is what the Democratic Party has become, and the only way to fix it is if the Democratic Party will look within and make it clear from their leadership on down that this is not sound politicking. This is not how they want America to be. And until you hear that from the leadership, things aren't going to change. Instead, we get people like Nancy Pelosi calling for summers of resistance, and Maxine Waters telling them to get up in Republicans' faces and to follow them to restaurants and so forth. So this is what's driving this madness and insanity, and until the leadership takes it upon themselves to accept accountability for the violence they're bringing into America's streets and reeling it back, then we're just going to see this.
Do you worry, and unfortunately because he's George Soros, there's part of me that almost wants to wait and see what the investigation into this explosive device is, because I'm sorry, I'm just not above thinking for a second that he wouldn't be beyond putting one of those in his own mailbox just to say, oh look, it's us too, because it had seemed almost cartoonishly only left-wing zealots yelling horrible things at conservatives. So it just seemed very timely as we get into October that, oh yeah, now all of a sudden the conservatives are going to come unhinged as well.
Yeah, I'm actually, that's one of the thoughts I had too. I don't think that's a tin hat theory or anything like that. I don't think the left, I don't think that's just so chess move strategy that the left wouldn't come up with some idea like that. Sure. I think that the left has been watching the polling regarding independents in women in this country, and they're seeing that independents by and large are having their stomachs churned at all this violence in the street, and they see that they may be in danger of losing some of their voting base because of this violence in the street. So what better way to even out the polling numbers than even out the violence? And I don't think that's off the wall to suggest that perhaps one of Soros's own minions or somebody on the left planted that in his mailbox. We'll see. But I think, common sense, people can see that the violence is being driven by the left on behalf of the left, and it's by and large the right and sane in this country who are opposing it.
Cheryl Chumley is on with us from the Washington Times, author of a great new book. Put it on your Christmas gift-giving list and add it. We've got so many great ones coming out. It's called The Devil in D.C., Winning Back the Country from the Beast in Washington. And I want to go into the subtext of what I get from your title, Cheryl, is that, we watch K Street and we look at how much money gets transferred. Both political parties, I think, are equally guilty of this. They've got their special interests. They've there is profit to be made by being the majority party in there. And all of this is what Trump, I think, spoke to so eloquently when he called it the swamp, is that there's just like this venture capital firm called the federal government. You have to give it your money because you go to prison otherwise, and then it gets to play with your money as if it's Monopoly game. Is that breaking up? Because there's a feeling, I think some people don't think it's breaking up fast enough.
Well, look, Trump was a president who did not take millions of dollars of donations from special interest groups because they didn't need to. And I think that's what set people on edge right off. The patriotic Americans cheered it because they could see that he was starting from a clean slate and wasn't going to enter office beholden to 100 different interests. But the 100 different interests, of course, were ticked off because their influence, from day one, they didn't have an open door to the White House. So my book actually opens with a chapter about the partisanship of politics and the money in politics, and it goes back in time to show that, our founding fathers never intended our nation to be politicized by partisanship. They did not even want set established political parties to win. They wanted all the candidates to basically win based on the people's vote. They didn't want just a Republican Party and just a Democratic Party. And this is where we're at now, and this is why there's so much money in politics, because it just is funneled through one of two different systems. And most of our politicians nowadays are basically bought and paid for.
Is there and this is a theory piece that I throw out to people at cocktail parties to have them think, oh, Joe's a little weird. But, let's start with something simple like removing the guaranteed ballot placement of both political parties and or guaranteeing anyone who, just pays the fee to the voter registrar, they get on the ballot like they do kind of in New York State, where you can have a Libertarian and a Green Party and there's no guaranteed spot for just the Republican and the Democrat, and sort of take that power position away where you have to kiss the ring of the party in order to get onto the ballot to get out in front of voters in the first place.
I don't see why that is. That sounds like a decent idea to me. I don't have a problem with that, and I also don't have a problem with Americans taking action on their own to reel back the influence of the main parties. For instance, I suggest stop funding the RNC and the DNC. Instead, take issues that are of concern to you and give your money to those nonprofits. I think Judicial Watch does a tremendous job of letting American people know what's going on behind the scenes in politics.
Oh, yeah.
And Judicial Watch is a nonprofit. So instead of donating to the RNC, why not give money to Judicial Watch? Or if housing, affordable housing is your thing, donate money to Habitat for Humanity. The idea is let's reel back the money going into the political system, the political machine, and start bolstering the amount of money that goes into some of these nonprofits that can actually do the work for the people, the little people in America, not the political parties.
I love what you're saying, because so often I feel like it's certainly the left, but I think there's a lot of Republicans as well who feel like, okay, I voted for the right person, I'm done here, I can go back home, and that's not, if a candidate for office says I want to help women and you vote for them, well, that doesn't relieve you of the need to maybe volunteer for a sexual assault agency or something like that. We can't vote for our good community services. We have to do them ourselves. That's a great idea for that, and take all that money away from them, because that is the power base of it. And as you mentioned, Trump really kind of came in around the outside of that. What do you make of the fact that the last couple of weeks we've seen a lot of Democratic candidates laughably having 2-to-1 or 3-to-1 advantages over their Republican opponents in fundraising, all of a sudden say, oh, and we need comprehensive election reform and campaign finance reform. I worry that we're going into a place where we're going to federalize our elections, and the government will determine who our candidates are and how much money they get. Is that a danger? Because I feel like conservatives are kind of being pushed that way as well.
Yeah, I agree with you, and I think it's rather dangerous. I find it hypocritical, the situation that you just described, Democrats right now. And I actually don't like any talk of limits to campaign funding. I think that that's just a natural First Amendment issue, that I, as an individual, should be able to donate as much money as I want to whatever candidate I want, because I have enough money to do it, and I want to see this person, in political power. And I also think corporations should be able to donate as much money as they want to whatever candidate they want as well. Where I think we need improvement, and massive improvement, is the sunshine that goes into the donations. I favor being able to give as much money to whatever candidate you want, so long as there is open transparency about where all that money is coming from.
Yeah,
and I think that's where we need to put our efforts.
And you mentioned Judicial Watch is a great regent of that. As a matter of fact, some of the very few things we've learned about Hillary's emails and things like that have come from Judicial Watch, but also a lot of the campaign finance issues, and even locally here, VPAP has been terrific. The Virginia Public Access process towards just putting it out, just for you to look at, whether it means anything to you or not. So where do you think? What is your sense going in as we finish up here, Cheryl? Going into the midterms, I said months ago that it's not going to be so much a blue wave as a rearranging the deck chairs on, insert name of cruise ship, Titanic, Lusitania, I don't know, depending on where you think we're going. And I think that the GOP is going to maintain a majority in both the House and the Senate, even though maybe a slim one in the House. What do you think?
Well, on my piece that came out Saturday in the Washington Times was entitled "Blue Wave, Smooth Wave. Polls are almost always wrong." And I believe that the Republicans are going to maintain in the House and Senate.
I think the worst nightmare for the Democrats would be actually winning control in the House and then finding out that Trump isn't, cowed into a corner like Obama was, and finding him actually getting deals done and getting things done, because I think that just would kneecap them even more. I think they're looking the worst nightmare for the Democrats might be winning in 2018 if they want to do anything towards 2020. But I see the American people rising up against the elites, and God bless you for being on the front edge of it. I hope everyone's going to Amazon. Is it Amazon best place to get the book, or is it Barnes & Noble, or can they order from you directly? Which is the best way to get the book, Cheryl?
Either those two or my website, CherylChumley.com.
Well, thank you, sir. It's called Devil in D.C., Winning the Country Back from the Beast in Washington. It's got to be the defining theme of the next at least 4 years, if not 10 years, because there's so much. And this didn't happen overnight, so I don't think we can expect it to be fixed overnight. But if I can borrow the hashtag woke, the American people seem woke now to what's going on, and I don't think they like it, Democrats or Republicans. Good point. I agree with you completely. Well, thank you so much for joining us, especially because you agreed with me completely, because I'm shallow that way. And that's it. Cheryl, thank you so much again. CherylChumley.com or WashingtonTimes.com as well. Thank you so much, and have a great weekend. You too. Thank you. Welcome back to this week's edition of Freedom and Prosperity Radio. Joining us now from the Pacific Research Institute, one of the leading voices fighting Obamacare from the moment when we really didn't even know what it was going to be or how they were going to do it. Just the mere thought of it drove Sally Pipes crazy, having grown up in Canada and studied healthcare her whole life, now at pacificresearch.org. Sally, welcome back to Freedom and Prosperity Radio. How are you?
Thank you, Joe. And yes, I don't know. I've been fighting this for so long. I thought I would have been able to hang up my boots a while ago, but it looks like it's going from bad to worse. With, as you know, with all of the Democratic progressives pushing towards away from Obamacare to even worse, Medicare for all or single payer.
I know, and it's amazing to me that the leftists are actually looking, sane by just saying, "Oh no, we want to bring back the individual mandate. We're not crazy like the Medicaid for all people." But we heard a piece. There was a joint debate in Lynchburg, Virginia, between the 6th and the 5th district candidates. And if it was possible to make the Democrat from the 5th district seem centrist, it was putting her on the panel with the 6th district Democrat, who, makes Che Guevara look conservative. And some of the rhetoric about the Bernie Sanders plan, Bernie Care, I guess we call it that, is that she's now claiming that she can pay for it by closing corporate loopholes and ending the crony bailouts in Washington. Is this the new flavor of the month of okay, we figured out that conservatives caught us on how you're going to pay for it, and now we're going to go after tax cuts and talk about 60, 70, 80% tax hikes?
Well, I mean, I think, as you know, Joe, back in 2016, Senator Bernie Sanders, when running against Hillary Clinton, came out with his first real solid Medicare for All plan. And, of course, he never talked about what it would cost or how it would be paid for.
Right.
The Urban Institute, not a right-leaning think tank, came out and said $32 trillion over 10 years. And, his plan now in 2017 was made into a actual Senate bill. He has 16 senators co-sponsoring it, and 4 of whom are probably wanting to be presidential Democratic candidates in the 2020 presidential election, from Kamala Harris going on down. But this plan that Charles Playhouse at the Mercatus Center costed it just over almost $33 trillion over 10 years. As he said, I mean, there may be a few reductions in administrative costs. I don't even believe there would be, because when people think something's free, they'll use a lot more, and the administrative costs will probably be even higher. But as he said, that if you doubled all of the corporate taxes and the personal income taxes, it wouldn't be enough to cover this single-payer system, which I think a lot of people don't understand, would mean there would be no private insurance. I think a lot of 160 million Americans who have employer-based coverage think, well, I'll keep my coverage, so that'll be for other people. But that's not the case. But the tax increases would have to be huge, and the results for us, long waiting lists, ration care, would be enormous.
I've brought this up on just a humanities standpoint. We see the protests in the poor communities over law enforcement that they feel is unjust. Can you imagine what's going to happen if the hospitals are run by the government and turn down somebody's grandmother for treatment, or won't let somebody's mom get treated for something? We think the protests against law enforcement are bad. I can only shudder to think of what they'd be like against a hospital that denied somebody care because of the rules laid in place by this kind of plan.
Well, you're absolutely right. I mean, the thing is that, in Canada, all the hospitals are owned by each of the provincial governments. And, the equipment is old. People in America would think that if they think that a community hospital is terrible, well, they should go and look at all of the hospitals in Canada, because they're not well maintained. As I say, the equipment is old, and the unions are in charge. I mean, the SEIU here in America is one of the big unions that's pushing for Medicare for all.
Sure.
But the health workers in Canada, I mean, they really control, the health care. They get the big salaries. They withdraw services. The same thing would happen in this country if we got Medicare for all.
Well, why do doctors seem to be in favor of this? They would be turned into nothing more than a cog in a wheel. They might make a little bit more than a nurse, but doctors and nurses are going to take the biggest hit of all.
Well, you're absolutely right. I mean, I think in Senator Sanders' bill, SB 1804, doctors would be paid rates tied to Medicare rates. So that would mean that doctors would be paid 30 to 40% below what they're paid for treating patients today. And that means, of course, many more doctors would actually retire early from medicine, move on to other careers, and the best and brightest would not go into medicine. The American Association of Medical Colleges just came out and projected a couple of months ago that the shortage of doctors by 2030 would be 121,000, which is 16% up over what they said a year ago, and that's because of all this push for single payer. Just one quick thing. I noted that the new president of the American Medical Association, a female oncologist from Santa Fe, came out and said that if Medicare for all came in, she would have to close her oncology practice in Santa Fe because she could no longer afford to run her clinic.
Well, that sort of tells you everything you need to know, and again, you're going to find it'll be a boom for hospice care because a lot of people will be told, sorry, you can't get treatment for that, or you're too old to get treatment for that, or there's not enough time for you to earn back your money in tax generations or anything like that. So you're going to find more people in their 50s and 60s being pushed into hospice care for chronic ailments like cancer and diabetes and things like that. They're going to be denied service because they're not young enough to pencil it back out for the society, and all these things that are not constitutional, yet they seem to think they can buy their way around constitutional prohibitions, Sally.
Yeah, well, I mean, what you say is exactly right. And if you look at the media coverage in Canada and the UK, Canada is the only country in the developed world that has a true single-payer system, i.e. all private coverage is outlawed. Great Britain, under the National Health Service, which just turned 70 this past summer, they allow private coverage to run parallel, and about 10% of Brits have private coverage, and they use it when they think they need an MRI or they need cancer surgery. But what you read in the press is about bed blocking. So there are a lot of elderly people in Canada and in the UK who, have nowhere to go, and so they stay in the hospital beds and keep the people that need actual surgeries out of the bed. So they're blocking beds and blocking people who really need treatment and surgery and treatment from getting into the hospital.
When I first heard and I saw emails from Mark Warner promoting Tim Kaine and bringing back health care, I said, gosh, have they really run out of anything else to use against President Trump and the Republicans? They're circling back around to this classic hit from 2008. It's a golden oldie, it's health care, but it's a winning argument because it's theoretical to so many voters. What would you do if? And it's that big gold embossed word if. If something happened to you, what would you do? Where would you turn? You'd lose all your savings. And it's all based in this hypothetical fear-mongering. But it obviously works because they've circled back around to it as a campaign idea.
Right. And so healthcare, as you know, is the number one issue on the minds of voters in this election coming on November 6th. And the other thing is that, the recent Reuters Ipsos poll showed that 70% of people polled supported Medicare for all, and about 80% of the Democrats that they polled supported it. But, as I say, I mean, how much is it going to cost? How is it going to be paid for? And people don't realize. They just think, oh, that sounds great. I'm going to have something for free, and I'll have the very best care and access to care that I would ever want. And they don't realize that in a country like Canada, where the average wait last year from seeing a primary care doctor to getting treatment by a specialist was over 5 months, 21.2 weeks. So the American people are, my mom used to say, you're becoming one of those impatient Americans. But it's true. They just wouldn't put up with ration care and the fact they have to wait. And Bernie's plan says that there would be no referrals to specialists. Well, that's one of the ways government controls cost. For example, in Canada, you have to see a primary care or general practitioner before you can actually go to a specialist. So if Bernie says there would be no referrals, I mean, specialists would just be overrun with patients, and their salaries, what they get paid would be much lower, and therefore this is going to be another way to push docs out of the practice of medicine, and the shortage would be even worse for us because we wouldn't be able to get access to care.
We're visiting with Sally Pipes of the Pacific Research Institute. We were told that the Obamacare, and you and I talked about it, going on 10 years ago now, that Obamacare was going to be used to collapse the insurance system. Sure enough, insurance companies started leaving as soon as the individual mandate got out of hand. So then you were left, like in Central Virginia, with 500% increases because there was only one insurance company left, and forcing people to cover things that they wouldn't normally cover creates an assigned risk kind of pool that you're going to have to throw people in. That's going to raise costs as well, and it's collapsing the insurance industry from the inside, just as you said it would. And I'm afraid that we're going to be left with this and no other choice in the matter. Right.
Well, when Obamacare turned 2010 to 8 years old on March 23rd of this year. And it was interesting, I always felt, and I think you and I agreed, Joe, that his whole idea was Obamacare, would not work. The exchanges wouldn't work, and therefore we tried, we've tried competition, and therefore now we need to go to Medicare for all or single payer. And interestingly, President Trump a couple of weeks ago came out and said in a USA Today op-ed that he was against single payer. This country could not afford it. Now, going back before he was president, he thought it might be a model. So I was very excited that he actually realized it would be too expensive and would deny care. President Obama, who when he was a state senator in Illinois was a proponent of single payer, then when he became president and Obamacare came into being, he said, well, he didn't support single payer because the American people love their employer-based coverage. And that is true, they do. And now he came out just a couple of weeks ago, I think on September 7th, saying the Democrats have a whole lot of new ideas out there, including single payer. So he's been for it before he was against it. Now he's for it again. It's really sort of interesting how this all, kind of has, unfolded. But it's a disaster. And as Seema Verma said, and President Trump used the same line, Medicare for all would become Medicare for none. And I think people have to realize that, what it would mean.
Well, and never mind the bankruptcy it would bring about. I mean, I think somebody said that $32 trillion is more money than exists on the planet right now anyway. But and so I don't know how you grow your way out of that. And I'm not sure of the statistic on it. But moreover than that, we hear talk of, portable and uncapped health savings accounts and major medical insurance, not assurance like we have now. Those plans are out there, yet, the Republicans had their chance with 2 years with President Trump saying, I'm sitting here with a pen waiting to sign something, and they couldn't do it. What hope do you have that the conservatives that are running now for some of these retiring Republicans, should they manage to keep control of the House, to do something, Sally?
Well, I mean, I was very disappointed, by late summer 2017, because President Trump and the Republicans ran on a repeal and replace agenda, and they weren't able to get it done, which was very sad. And then, of course, the Democrats have been saying, well, they were for, increasing the Obamacare law, and as we saw with, high premiums, high deductibles, small networks of doctors and hospitals, that the American people didn't like it, and only 11 million people signed up on the exchanges. We turned our healthcare system over for 11 million people. But now, we're going into this election, as I say, people like Alexandria Ocasio-Cortez, Bernie Sanders' darling, who upset the 10-term Democrat Joe Crowley in New York. You've got the Tallahassee mayor, Andrew Gillum, running for the Democratic gubernatorial in Florida, running on Medicare for all. You've all these people running on Medicare for all. So my hope is that it's very important that the Republicans keep the House. I think that they will, just watching things in the last few weeks, but I'm very much an outlier. People don't agree with me, but it's so important for the Republicans to keep the House so that in January of 2019, I hope that they would work hard to repeal and replace Obamacare. We've seen some very exciting things under the administration with Secretary Alex Azar, Trump's executive orders on short-term limited duration plans, bills to expand HSAs, now the health reimbursement accounts for small business groups, which the Treasury says 10 million, will sign up. The association health plans to help sole proprietors. I mean, all of these things, getting rid of the individual mandate, are all sort of nails in the coffin of Obamacare. But we really need to get the whole thing off the books. Otherwise, as you know, Joe, things, they're just sort of on the back burner. A new party comes in, and then they come back again.
Right, and especially when they've become personal. And I knew as soon as we named it Obamacare, he'd take it personally if somebody tried to tear it apart, even if it was a horribly bad idea. Sally Pipes from the Pacific Research Institute, when the dust settles, and I said this 6-8 months ago. I said this blue wave was not going to happen. It was going to be a rearranging of some deck chairs, perhaps, and then we can debate whether it's the Lusitania or the Titanic we're rearranging the deck chairs on. But at the end of it, will the message be in some of these new incoming Republicans that are replacing some of the retiring ones? Do you think they have a plan? I listened Denver Riggleman here in Virginia, very much a health savings accounts, major medical insurance kind of guy from running his businesses, having been a veteran, seeing how the VA works as a bureaucratic government healthcare system. Are enough of these freshman Republicans able to bring it, or does the president need to say, hey, here's my idea, I'm giving it to Kevin McCarthy or Jim Jordan, whoever winds up as the speaker, do something with this?
Well, I hope that the Republicans keep the House and maybe increase seats in the Senate. I think it is I'm hoping that a lot of these new younger faces who haven't been in government are going to be fresh faces that say, we need to get rid of Obamacare. We need to repeal it and replace it with a plan that empowers doctors and patients, not the federal government. So that is my goal. How it's done, I think President Trump, being a newbie back in January 2017, didn't realize how difficult this was going to be, and he should have gathered the cats in the laundry bags and told them, we ran on this, we need to do it, let's get everything organized and then send it out. Instead of every new bill came out, and then there was dissension among the Republicans, and so with John McCain versus Ted Cruz versus Ben Sasse versus Rand Paul. So, they were sort of airing their dirty laundry in public, and they didn't get it done. So I think that President Trump would realize he needs to get this lined up in advance and then work with, whoever the new speaker is, and also then, of course, Mitch McConnell will continue to be head of the Senate. So they need to get this done, and they need to be really hardcore about it, because the American people would not want a healthcare system where they had long waits. Even if you look at Medicare, which the Part A is proposed by the Medicare trustees to be bankrupt by 2030, and Medicare is not free. 20% of Americans who are on Medicare have to go out and buy Medigap plans or Medicare Advantage plans, because otherwise they can't get a doctor to treat them. And so it really, I think that people don't realize that it is not free. In addition to that, they have to pay all of their taxes and they still have to shell out, say up to $300, $400 a month for a plan that allows them to have access to their doctor.
That's a big hit for someone in that order. Sally, because I hear you on CNN and NBC News all the time. I know Holt and these guys are always calling you to interview you on this. That's my tongue-in-cheek, by the way.
Yeah, right, exactly.
The media is, I think, halfway behind this polling data that says, all these Americans want single payer, because that's what they're getting fed to them by the media. How do we overcome that?
Well, I think you're absolutely right. When President Trump talks about fake news and things, it is true. The media has a tremendous influence on the American people, whether, as I say, the Reuters poll, 70% support single payer. Well, they never talked about, do you support it if your taxes are going to go up significantly, or the fact that you can't get access? Yeah. So we really, myself and a number of others in the movement, we're spending a lot of time trying to educate the American people on, how single payer would be detrimental to their health, but to try and get, the Lester Holts of the world to, bring this out. It's very difficult, but I think talk radio is a great way. The young people, are into listening to podcasts. So this is our
platform
cross to bear.
Yeah. Well, and it's the best way to do it, and I think it's much more direct. And I think the president, during his campaign and during this midterm spate of events, is showing that we can do this hand to hand. We don't need to just wait for the nightly news to put us on there, and nor do we have to buy expensive TV ads to get the message out there either, Sally. So, crystal ball, we got 2 minutes left. What does the next 2 years look like, Sally?
Well, if I'm right, and as I say, most people say I'm wrong. If the Republicans hold the House, keep the Senate, or expand the number of senators, I think it's in their interest to get rid of Obamacare, because if not, it could come back. So, and the thing is that I think the Democrats will have their tail between their legs because they've moved so far to the left. So they're going to have to do a major look into their crystal ball and say, well, we went very progressive. It hasn't worked, and therefore we better sort of start looking at our agenda and come up with some new policy ideas, which would not include free university tuition, free medical school, free Medicare for all being free. So I think we have a great opportunity, but it's up to the voters, what they do on November 6th. But it's a very important midterm election.
And does the speaker make a difference, Kevin McCarthy versus Jim Jordan, which is what it seems like if the Republicans keep the House?
Yeah, I mean, I think they both. Scalise is in there too, Stephen Scalise. I think they all would be good. I mean, I was a bit disappointed in Paul Ryan. I think he, could have been much tougher on this, because he had a white paper on, what the replacement plan for Obamacare would be. So it's going to be interesting. But I think if the Republicans do keep the House, any one of those three would be a good speaker for the House side.
Sally Pipes, Pacific Research Institute, and it's pacificresearch.org. Thank you so much for joining us this week.
Thank you, Joe. Take care. Bye.
And thank you on behalf of all of us here at the Virginia Institute for Public Policy. I'm Joe Thomas. So long, and thanks for all the fish. Thank you.